everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. E-cigarette use linked with the risk of prediabetes. E-cigarettes are not considered to be any better than a regular cigarette. They are equally harmful. Scientists still have a lot to learn about whether e-cigarettes are effective for quitting smoking. We at Medical Dialogues had previously reported that painful and harmful effects of e-cigarettes on gums. However, its harmful effects still continue to rise. A recent survey shows that e-cigarette use is associated with increased odds of prediabetes, and the findings, which are reported in the American Journal of Preventive Medicine, add important evidence about the health effects of e-cigarettes and can help shape public health best practices. Now, as we all know it, prediabetes is a reversible condition with lifestyle management, and based on these present findings, the authors did make a compelling recommendation for targeting the reduction in e-cigarette use and also education of the young adults as a therapeutic lifestyle management strategy for the reduction of diabetes risk. Prolonged exposure to angiotensin-receptor blockers linked with cancer risk. Recently, regulatory agencies have started to identify possible carcinogenic nitrosamines and azido compounds in a multitude of formulations of several angiotensin receptor blockers, resulting in progressive recalls. In a recent study, the researchers have found that the risk of cancer with ARBs, and specifically confining to lung cancer, increases with increasing cumulative exposure to these drugs. The study findings were published in the PLOS One journal, wherein the authors concluded that these analyses does show that the risk of cancer, and specifically the lung cancer, increase with an increasing cumulative exposure to ARBs. Tic severity linked with social media use for teens during pandemic. Social media usage among the younger generation has reached its peak. With Instagram Reels and YouTube videos, it does have taken a toll on them. How? According to a small preliminary study, an increase in social media use among teens and young adults during the COVID-19 pandemic may be linked to an increase in tic severity. The study results have begun to shed light on the impact that COVID-19 pandemic and the increased social media use may be having an effect on teens and young adults with tic disorders. Periprocedural antithrombotics dangerous for endovascular stroke treatment. A recent trial published in The Lancet evaluated the efficacy and safety of antithrombotics using both of them as treatment options, but found no better outcomes. It was a randomized controlled trial that was conducted in 15 centers in the Netherlands. The patients in the trial were randomly assigned to receive either periprocedural intravenous aspirin or no aspirin, and unfractioned heparin or no unfractioned heparin. Symptomatic intracranial hemorrhage was the main safety outcome. The risk of symptomatic intracranial hemorrhage was considered higher in patients allocated to receive aspirin than in those not receiving aspirin, that was 14% versus 7%, as well as in patients allocated to receive unfractioned heparin than in those not receiving unfractioned heparin, the combination being 13% versus 7%. The trial concluded that the periprocedural intravenous aspirin and unfractioned heparin during endovascular stroke treatment are both associated with an increased risk of symptomatic intracranial hemorrhage without the evidence for a beneficial effect on functional outcomes. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.